terrorist, I don't care what you say. I don't care what you think. You can smile at me, you can say whatever you want. But every Muslim is a terrorist.
Being a Muslim in this country and facing all of this every day is not funny.
Just like my son.
No. Will you talk to your son like that?
My son, no.
Will you call him by the name of a terrorist?
No.
Khalas. How can you call him like that?
No problem.
In front of so many people in a class.
Sorry.
Have you ever been told that a Muslim is nothing but a terrorist? All Muslims are terrorists. Muslims contributed nothing to the world except killing and terrorizing others. And when someone says that to you, what is your reaction? In most cases, you feel angry, but you don't have any substantial point to prove them wrong. Why? Because you didn't study about the golden age of Islam. It is disappointing to know that we ourselves know very little about our achievers. How will others know it? But that is about to change, and it begins here. Today, I will share a story of a man who changed medicine and saved countless lives with his innovations. So watch this video till the end and then share it with your friends and family so they learn too. 1,000 years ago, man achieved something that helps our sisters give birth. He cleverly used anesthetics to keep pain very low during surgeries. He invented more than 100 surgical equipments, many of which are being used even today. He was the first person who emphasized on dental health and made the first toothpaste mankind has known. He was the most celebrated surgeon and physician from a place called Zahra, and his name is Abul Qasim Az Zahrawi. And today, I will tell you his story on how he went on to become a legend in the world of medicine and saved countless lives. Our story begins in Andalusia, which is the modern world Spain. He was born to influential parents in Zahra, a city close to Cordoba. He then went on to get highest level of education on medicine from none other than the legendary Ar-Razi. He always wanted to serve mankind with empathy. His teachings revolved around the conditions and care for patients. Many habits that we noticed today in hospitals come from his learnings. His first priority was the well-being of his patients. He always wanted to make them comfortable and cure them with minimum pain. This is why he invented more than 100 surgical instruments and also made use of opium as an anesthetic to alleviate the pain the surgery might cause the patient. He was one of the foremost persons to use the method of cauterization to stop the bleeding. He always guided his fellow physicians to keep the wound clean in order to prevent infection. He was of the opinion that no patient is different irrespective of his religion, financial status, and creed. He was very strict and followed the patient-doctor confidentiality. He also believed in keeping historic records of patients in order to have a better understanding of medication that needs to be given to the patients, just like we do today. He invented groundbreaking instruments called bone saw, a surgical needle, the syringe, and the lithotomy scalpel. The most contributing was forceps that he used in childbirth. He did that in order to assist in childbirth and to alleviate the pain mother goes through during labor. His definition of syringe is the oldest definition ever known to mankind. So I might not be wrong when I say the first definition of what syringe is comes from Az Zahrawi. He wrote a detailed 30-volume book on medicine, surgery, which became a textbook in the European countries and was used extensively during Renaissance period. They later Latinized his name to Abul Qasim. The name of this book is just as glorious as his work was. He named his book The Arrangement of Medical Knowledge for the One Who is Not Able to Compile a Book for Himself. In Arabic, it is called At-Tasrif. In other words, method of medicine. When it comes to medicine, we all know the Canon of Medicine by Ibn Sina, and perhaps a few might also know about the book by Ar-Razi named Al-Hawi. However, this book was on the same level, and for 5 centuries, these books were used together in hospitals of Europe. Europe. His work was extensively translated by Gerard of Cremona, which was the primary source of information for the European countries. And he earned a lot of respect as Abul Qasis, even more than what he achieved in his native lands. Abul Qasis was a strong advocate for the empirical and practical aspects of medicine, particularly surgery. He would have many of his students observe the surgery while he carried it out. He believed this practical knowledge is the best form of knowledge one can pass on to the next generation. Unlike many of his predecessors who focused on theoretical knowledge or philosophical texts, he believed in practical information. Az Zahrawi died in 1013, but his contributions in the Islamic world continued to be influential for centuries after his death. His texts were studied in medical schools in the Islamic Golden Age and beyond. Persian, Ottoman, and Arabic physicians continued to reference his work long after the fall of the Caliphate of Cordoba. I hope you liked this video. If you did, please give it a thumbs up and share with friends. If you'd like to watch a video on hijab and if hijab is mentioned in the Quran or not, click this video now.